Good evening, everyone. It is so great to have you here as we come together to celebrate National Oral Pathologist Day in India, a day dedicated to our field and to honoring Dr. H.M. Dolakia, the first oral pathology postgraduate teacher in India. Across the country, many are marking the occasion with pathology focused events, and we are thrilled to be part of the celebration in a way that truly reflects Dr. Dolakia's spirit, bridging disciplines and fostering collaborations. I feel especially privileged to be speaking about him today because I was fortunate to have him as my teacher. And I can personally attest to what so many say about him. Not only was he an incredible educator, but he had a warm, approachable nature that made him a respected figure across disciplines. He didn't just teach oral pathology, he made sure we understood its place within the larger healthcare system. And that's exactly why we are here today to talk about International Oral Diseases Case Presentation Conference, or IODCPC25, a multidisciplinary conference that brings together experts from oral medicine, pathology, surgery, radiology, and even beyond from other disciplines like homeopathy and Ayurveda, representing diverse specialities and countries from across the globe, providing a chance to break all barriers for better patient care. This year's theme, State of Knowledge in Oral and Maxillofacial Diseases, is our way of taking stock of where we truly stand today. There's so much of buzz about cutting edge advancements, AI, digital pathology, digital radiology, robotics, and so much more in terms of innovations that it is sometimes hard to separate what is already in clinical use from what is still in the research phase. We felt that truly to be prepared for the rapid progress ahead, we need to first establish a baseline. What do we actually know? What is actually being applied in clinical practice? And where are we headed next? That is what IODCPC 25 is all about, a realistic multidisciplinary look at the present state of knowledge. So we can be better equipped for the future, which we know will be quite amazing. Tonight, our incredible organizing team, or at least most of it, since all could not make it, will walk you through why IODCPC is a must attend event. Each of them will answer one key question: why should you attend IODCPC 25? We'll cover everything from key highlights and pre conference courses to abstract presentations, scholarships, and more. And of course, we will be taking our live questions as usual at the end. So don't be shy, drop in your questions in the chat and we will definitely reach them. To kick things off, let's hear from Dr. Ravikant Maniam, the scientific convener of the conference and representing Vishnu Dental College India. He will tell us what makes IODCPC unique. Over to you, Dr. Maniam.
Thank you, ma'am. Now, let's talk about what makes the International Oral Diseases Case Presentation Conference 25 truly unique. There are many conferences in oral health, but IODCPC 25 stands out because of its multidisciplinary approach. This isn't just an oral pathology event. It's a space where oral medicine, oral surgery, radiology, pathology, and beyond come together. If you have ever felt that conferences focus too narrowly on one specialty, this is your chance to engage with experts across disciplines, helping you gain a broader and more integrated understanding of oral and maxillofacial diseases. And it's not just about disciplines, it's about a global perspective. We have speakers and attendees from over 35 countries, bringing in diverse clinical experiences, research insights, and innovative approaches from across the world. Another thing that sets IODCPC 25 apart is its focus on both diagnosis and management. We hear a lot about advancements in research, but how much of it is actually applied in daily practice? That's exactly what this conference explores. It helps us establish a baseline, What do we know? What's actively being used? And what's still in development? And of course, being a virtual conference on vFairs means that no matter where you are in the world, you can learn, network, and present your work without travel constraints. You'll have access to live streams, discussion lounges, digital exhibition booths, and interactive question and answers, all from the comfort of your home or office. So, whether you are a clinician, a researcher, educator, or a student, IODCPC25 is designed to give you a practical, real world understanding of oral diseases across specialties and geographies. With that, let's move on to the next exciting part, how this virtual experience on vFairs enhances learning and engagement. To tell us more, I'll hand it over to Dr. Anupama Mukherjee. Over to you, Dr. Anupama.
Thank you, Dr. Ravikant. So yes, that is a very valid question. That how is the IODCPC a unique virtual conference? So at the IODCPC, delegates have the opportunity to interact and exchange ideas with stalwarts in the specialty and even establish new connections around the globe. Now, this global representation of speakers, presenters, and delegates make IODCPC one of a kind of a conference. This surpasses the constraints of geographical boundaries and time zones. From being a melting pot of knowledge, ideas, and experience, what also makes the IODCPC unique is this platform. So it's not just another webinar, but rather an experiential 3 days of knowledge and informational exchange. So to give you an overview of what this platform, vFairs, has in store for us, let me walk you through a little bit. So using this platform, the IODCPC recreates the ambience of an on-site conference. As you can see, it's much like you would have been at a wonderful venue, and as you enter, you arrive at the lobby. So the auditorium is the main venue for all the lecture sessions, and the details are organized and made available day-wise. We also have real-time updates for upcoming and ongoing sessions, as well as those which are going to be available for replay. You may also choose to visit the exhibit hall, which is a place where you can interact with members from different organizations, or you may choose to visit the lounge between the sessions, which is a great place to have easy conversations, be it catching up with colleagues, meeting like-minded people, exchanging notes with fellow delegates, or even discussing your ideas with experts. Now, the top toggle is an easy way to shift between venues, and you can view posters in the dedicated viewing area. For all your queries, we have a dedicated info desk to help you out. So one of the highlights is that this entire experience of the conference can be easily accessed from the comfort of your home. Another exclusive advantage of the IODCPC is the replay option. Now, all sessions will be available at replay, and you can access them at a timing which is comfortable and suitable for you. So no matter where you are or what time it is for you for a live session, at IODCPC, we make the effort to make this exchange of knowledge and the opportunity for learning available to all. So with that, I request Dr. Ashwini Deshpande to shed some light on the pre-conference for the IODCPC.
Thank you very much. A very good evening to everyone in India and around, and probably a morning elsewhere. Now, the IODCPC has come up with this great idea of a lot of pre-conference courses. Now, why do you even need a pre-conference course? Well, a pre-conference course largely is a type of a training session, basically a prelude to a conference. So here, we hope that students, doctors, all of them will be trained prior to the conference. It will cover a lot of broad range topics which will benefit not just UGs, PGs, postdocs, just the entire spectrum of a doctor. And like Dr. Mandana said, we are not constraining ourselves to just one topic. We have 4 tracks, as we call them. Now, in those tracks, we have oral medicine, oral pathology, oral surgery, oral radiology, to name a few. And in each of these branches, we have 2 speakers each. And each of them are going to cover topics which are, well, very basic to start with. For example, we have in the dentistry track, like for example, the first track is the dentistry track. We have something as simple as a biopsy procedure, which is very neglected, but we have succeeding it. We also have diagnosis and management of common oral lesions. Now, the speakers are very senior and very accomplished in their branch. It has been very tastefully selected, both the topic and very thoughtfully selected the speaker. Now, our oral medicine track ranges from xerostomia tilism to management of orofacial pain. So we are trying to encompass a lot of the branched out topics, which are probably you'll find them in textbooks, but having real-time assessment and diagnosis and treatment is a different ballgame. We have digital pathology to enhance education and consultation services in the oral pathology track. We are also covering oral epithelial dysplasia. Life is very mundane and easy, but when you have things like a zero ridge for an implant, that's when we have to put on our thinking caps and think of how we want to deal with it. So this is one topic which is covered in the oral surgery track. The oral radiology track, like we say, the doctor may never be replaced, but a doctor who does not know artificial intelligence enough may be replaced. So we have topics which are covering digital and advanced radiology in dentistry. And also, we are also providing insights of the CBCT for a practitioner from a TMJ perspective. Now, all said and done, we're not constraining ourselves to just one branch. We're not constraining ourselves to just one section of dentistry, but it involves like an entire plethora of dentists and allied specialities. Now, like I said, the people whom we hope to benefit, who are undergraduates, there are postgraduates, postdocs. I'm a PhD student myself, and I keep listening to a lot of the lectures on this series, and it is quite startling to see how much is still left to explore. So going on with this, I would like to hand over the session to Dr. Karpaga Selvi. Thank you very much.
Hi. Good evening. And we come to the best part of our IODCPC, meeting the speakers. And as we all know, it is an international conference with truly experts or stalwarts in each of their fields. So we start with the first speaker to Professor A. Rosker, who is a clinical professor and director of oral medicine in Department of Oral maxillofacial pathology, radiology, and medicine at New York University College of Dentistry. So he will be talking about AI in oral medicine. The next speaker is Dr. Kiara Barr. She's a pioneering dermatologist and will be talking about the hidden triggers of oral diseases and how they leave its mark on the oral mucosa. Then we come to the oral surgery part. The speaker is Dr. S.M. Kotra Shetty, professor who is also coordinator for Center for the Correction of Dental Facial Deformities at KLE University. And he will be covering management of nerve injuries in general dental practice. Apart from that, we have also Professor Rushdi Hendricks, who will be covering one more surgery, the oral radiology part. All of you who have attended the previous year's IODCPC, you would be familiar with Dr. Professor Leon J1. He's an extraordinary professor of radiology from South Africa, and he had conducted a very excellent lecture on imaging. And this time he will be covering imaging of metastatic and recurrent diseases of head and neck. Apart from that, we have Dr. Flora Zarvu-Valvi, who is president of Hellenic Society of Hospital Dentistry and Special Care Dentistry. She will be covering medical risk assessment in elderly dental patients. Then we have Dr. Josh and Amane Bar, who is expert in oral medicine, oral cancer diagnosis, and systemic dental care. He shall be covering on a topic that is hematopoietic stem cell transplant and oral mucosa. So along with these keynote lectures and guest lectures, we have something interesting this time. We have chairside panel discussion and symposiums. One of the interesting chairside panel discussion is whether lichen planus is a benign condition or potentially malignant disorder. And this will be with experts, Dr. W.M. Tilakratne and Dr. Ellen Eisenberg. And apart from all these specialities, we are also trying to see how integrative medicine can help in the treatment of oral ulcerative lesion. So we, apart from our allopathy experts like the oral medicine expert, Dr. Ishwaran Rameshwaram, we also have experts from alternative medicine like Dr. Savita Angadi, who is an Ayurvedic doctor, among others. So we are hoping to have a truly international conference with stalwart speaking. And this, I feel, is the best part, because sitting at home within your own country, you are being exposed to all the international speakers. And I feel this is the best part of the conference. So I shall hand over to Dr. Mandana to carry on with the next part of the session, that is abstract submission.
Yes, thank you, Dr. Selvi, for that nice introduction of the lectures. So going on with where you can participate, where you can present your work, there is going to be a combination of three things. One was, some were already there last year, and that is either the individual case presentation or the case series, if you have a collection of more than three. And these were both as oral or poster presentations. This year we have an additionally new thing, that is diagnostic innovations. But one thing remains common to all of them, and that is the way the abstract submission goes. So the abstract submission requires for the presenting author, the person who is going to actually present it, needs to be registered. The registration process is through the website, and something we'll cover at the end. Somehow I think we have forgotten so far. We'll cover it up right at the end, but you need to be registered, and you will get a registration ID from us, which is required for submitting your abstract. So that is the process that you need to go through. And all the abstracts are eligible for being published in a ISBN registered book. And this the abstracts that are published like this will also be searchable on Google Scholar Index. But of course, being published is a choice that you make. You can decide not to be included, but really it does not affect your chance of continuing on to publish the paper, the whole case, because this is only the abstract and you continue to hold the rights to the abstract. So there's really not much of a reason, as far as I can think, why you shouldn't want your work published. But nonetheless, it's still something you have a choice. And if you want the paper to be published, all the authors have to be registered and attend the conference. There's also co-authors also will get certificates, but again, for that, they need to be, of course, registered. From this, I will hop on and let Dr. Nandini talk about the oral presentations and the abstract submission.
Thank you, ma'am. Greetings, everyone. Myself, Dr. Nandini from Dental College, RIMS, Imphal, Manipur, India. I will be the convener for the oral presentations. How unique is this case conference is? See, most of the conferences, you will have the original research which will be showcased. But here is a platform, unique platform, where you can present your case reports and case series.
Nandini, we lost you. You have to repeat yourself.
Okay. So this is a unique platform which is hosted by Dr. Mandana Madam, who is the driving force behind this entire conference, along with the other academic partners, including our institute. And this is a very unique platform in the words that other conferences will have usually original research which are showcased. But here, this is a unique conference wherein case series and case reports are presented. So that is why it is very important. And the staff as well as the students can present. And there is a prize for every category, whether it is faculty or the practitioners or the students. Further, as ma'am said, the abstract guidelines have been updated in the website. So kindly refer to them and submit your abstracts at the earliest. The selected abstracts will be divided for the poster presentation and the paper presentations. And you'll get an email intimation that whether your abstract is accepted for presentation, paper or poster. Once you get that, you will have to do a recording of less than 8 minutes and then submit it within 15th of April 2025. For diagnostic innovations, the recording should be less than 5 minutes and it also has to be submitted within 15th of April. And one more important thing is this conference gives us a platform to interact with various researchers and speakers all over the world. And you will be able to see the recordings also at a later stage within 15 days after the conference. All the delegates will receive the certificates 15 days after the conference. So grab the opportunity and we look forward for all your participation. Thank you so much. Next, I would like to hand over it to Dr. Eronima. Thank you.
Hi, good morning, at least here across the pond. I live in Argentina. It's in the morning. So we are very excited to present to you. I am responsible to the poster presentation, which will consist a PDF of the whole poster plus a 3-minute video. You can find all the details in the guidelines, and remember, up until the April the 15th, you can do it. So you have your chance. This represents a unique opportunity to reach a global audience of passionate professionals worldwide, from people just dipping their toes as students, such as pretty much anyone in here did long time ago, to educators, to renowned experts in the field of oral pathology, oral medicine, surgery, and associated specialties. Whether you bring a case report or an innovation or a case series, your work is welcome and will be showcased to all the world. That's it for me now. Thank you, and we are hoping to see you soon. Who is the next one? Oh, Dr. Prasad, go ahead.
Hello, everyone. I am Dr. Prasad, Professor and Head of the Department of Oral Pathology and Microbiology, KSR Institute of Dental Science and Research, Tirchangood, India. I am here to introduce about an entirely new session that is being introduced in this International Oral Diseases Case Presentation Conference 2025. This is called Diagnostic Innovations Showcase. Now, this is the first time ever that we are having a separate session on diagnostic innovations like this. And through this session, we actually hope to bring together the brightest minds and the latest innovations in the field of oral diagnostics. Now, what we want to listen to in this session is about cutting-edge technologies and innovations, whether it is advanced imaging techniques or some groundbreaking molecular diagnostics. We would like to listen to how these technologies are empowering you as a healthcare professional to diagnose disease more efficiently and accurately. So through this session, we hope that the audience and the participants, they gain insight into the latest diagnostic trends and innovations, get an opportunity to network with professionals and researchers who are already using such technologies, and also learn about the real-world applications of such diagnostic innovations. At the very least, we hope that the audience and the participants are inspired by the work and the success stories that are presented in this session and get some ideas to implement such diagnostic innovations in their routine practice. So that is about the Diagnostic Innovations Showcase session. I would like to now invite Dr. Eleni to talk about how IODCPC25 is honoring experts. Over to you, Dr. Eleni. Thank you.
Thank you very much, Dr. Prasad. I am Eleni Georgakopoulou from Greece. Following last year's success, we are once again dedicating a special session to honor leading experts in oral medicine and pathology, those whose work has shaped our field and whose impact continues to guide research and clinical practice. Among the distinguished figures we recognize, two of the honorees this year are Professor Laskaris and Professor Jerry Boucault, both of whom have been outstanding in their contribution to research, education, and clinical advancements in our specialties. They stand alongside many other esteemed colleagues whose work has defined and elevated the field. This session is more than just a tribute. It is a rare opportunity to see real people behind the discoveries, the studies, the publication we reference so often. Too often, we recognize names in journals, but never get the chance to connect with the individuals behind them, to hear their journey, their challenges, and their perspectives. Oral medicine and pathology is a specialized but very strong global community. We may be few in number, but our impact is significant. These sessions bring us closer, helping us build stronger connections, exchange knowledge, and create new collaborations, like the ones I'm enjoying 2 years now with Oral Pathology 360. The word colleague comes from the French word confrère, meaning more than just a professional partner. It stands for respect, shared purpose, and the bonds that unite us across borders and careers. Recognizing those who paved the way, it's not just an act of appreciation. It is a moment to learn, to be inspired, and to strengthen the future of our field together. Please join us in May in this unique session as we honor some of the pioneers of oral medicine and pathology to celebrate their legacy that connects us all. Thank you for your time. And now I want to pass the stage to Dr. Bhuvan Nabgal, who is going to speak about sponsorship and partnerships. Thank you.
Yeah, thank you so much, Dr. Eleni. I'm Dr. Bhuvan Nagpal. I'm the director of Tohana Mangalam Diagnostics and director of Center for Oral Pathology and Maxillofacial Diagnostics. Along with that, I'm the founder president of POPMA, that is Practicing Oral Pathologists and Microbiologists Association. First and foremost, I would like to thank Oral Pathology 360 and Dr. Mandana Donoghue for providing me the opportunity and having the trust in me to take the event forward with the sponsorship and the partnership. So why corporate and industry participation is essential at IODCPC 2025, the International Oral Disease Case Presentation Conference 2025, which is organized by Oral Pathology 360, and the major role is by Dr. Mandana Donoghue. It is not just an academic event. It is a strategic global platform for business networking, industry collaboration, and cutting-edge innovation in oral healthcare. With participants from over 35 countries, this event presents unmatched opportunities for corporate leaders, industry professionals, and innovators to connect, engage, and grow. There will be unlocking of business and networking opportunities with vFairs, which is our platform. At IODCPC, we bring you vFairs, which is a dedicated virtual platform designed to facilitate seamless interactions, business collaborations, and networking. Whether you are looking to establish new partnerships, expand your market presence, or engage in high-impact discussions, vFairs provides a structured environment for scheduling the mini meetings. You can connect with the key stakeholders, distributors, researchers, and industry experts in one-on-one or group settings. Organizing private business discussions. Explore investment opportunities, technology partnerships, and trade agreements with leading professionals in the field. Engaging in inclusive and exclusive networking areas. vFairs enables direct communication with decision makers, innovators, and thought leaders to foster long-term collaborations. If you are interested in leveraging vFairs to arrange strategic meetings, explore partnerships, or optimize your industry engagement, please reach out to me directly, and I will ensure a smooth setup tailored to your needs. Why IODCPC offers to corporate and industry leaders? Because there is global market expansion. As we are connecting with a diverse and international audience to explore opportunities in oral and maxillofacial diagnostics, research, collaborations, and business expansion. Cutting-edge innovation and technology. So it will make us stay ahead with insights into the latest advancements in oral and maxillofacial diagnostics along with the treatment solutions. Industry and academia collaboration. Get direct access to leading researchers and institutions to foster product development, clinical research, and joint ventures. Exclusive sponsorship and branding opportunities. Gain prime visibility through sponsorship, speaker slots, and strategic brand positioning. A unified global effort in oral healthcare. So join the movement to redefine the oral healthcare diagnostics, enhance patient care, and bridge the gap between industry and clinical practice. How to get involved? If you're interested in leveraging vFairs to maximize networking, trade, or collaboration opportunities, you can directly contact me. Secure your partnership, sponsorship, or speaking slot today and be a part of this global revolution in oral and maxillofacial diagnostics. Get in touch now to explore opportunities and partnerships at IODCPC 2025. Partner with IODCPC 2025, where industry meets innovation. Thank you so much. And now I hand over for a global reach out to Professor Jaws Hill.
Good day, everybody. It's quite an honor for me to address you all on the importance of international outreach, especially on the realm of our specialized dental discipline that we address in this conference. As we gather here in this virtual conference platform, I think we should remind ourselves of the unique opportunity that the technology provides us to bridge geographical divides and foster collaboration on a global scale. I think that everybody knows that in our field, where the pursuit of medical excellence, dental excellence, transcends borders, and we're not only concentrating on countries that are well established in the field of oral and maxillofacial diseases, but also in countries which have traditionally been marginalized in the inclusion of the broader international discussions. And I think that we on this platform are quite proud to face and try to pursue the challenges where we can discuss rare diseases, innovative treatments, cutting-edge research, and show that this is not confined to any particular group of countries or region, but is truly a global initiative. And I think by reaching out and collaborating internationally, we unlock that potential for shared knowledge, diverse perspectives, and collective problem solving, because we still need to do that, despite that we think that we know it all. And there's also the use of artificial intelligence. We must never underestimate the beautiful capacity of our human minds to integrate all that knowledge and to take the care for our patients to a next level. And we learn from each other's successes and setbacks. It allows for best practice, clinical experience, unearthed research findings that we never wrote, and that can all elevate the standard of the care for our patients worldwide. And importantly, for ourselves as professionals, it fosters cultural understanding and empathy. It enriches our approach to patient care and medical education or dental education, knowing that this is shared by many of our colleagues in the world. So we must seize this opportunity to build robust, well-recognized international networks. And I think this conference will allow for partnerships, joint research projects, perhaps educational exchanges. And by doing so, we can amplify the impact and accelerate the process in our specialized fields. I think let us embrace the power of international outreach using this platform, improve our patient outcomes, our diagnostic outcomes, and we create collectively this more inclusive and collaborative specialist oral maxillofacial care community. Thank you very much for your attention. I look forward to fruitful discussions in this particular conference and the collaborations that will arise from this conference. And I would like now to hand over to Dr. Yakin to enlighten us about the scholarships that are encompassed in our program of Oral Pathology 360.
Well, thank you, Professor Hill, and what's a great introduction to this topic, to this important topic in terms of global outreach and focus on inclusivity and also getting those less advantaged to have a go and engage with the wider profession globally on a global scale. So on this note, for this oral pathology, with 360, which is led by Mandana, and really provide a really good platform, a great platform for people to connect throughout the world. And in this upcoming conference, there's actually an initiative which is called the Equal Opportunity Access. Now, what this means is that there will be 10 registrants who will only pay 50% and then enjoy full access to all the workshops and conference sessions. The eligibility criteria and post-conference requirements are on the website, but just briefly, in those, it's for those who are mostly affected by financial and other constraints, whether on a national level or on a personal level, but also those in conflict affected areas in the world. So, and then following the attending the conference, then they would be asked to do a short 2-3 minute video after the conference, reflecting on what they benefited and how they benefited from this conference. It is limited to 10 seats only, and all the application details are on the conference website through a brief application form. And all the applications will be reviewed on a rolling basis and the outcomes advised later on. Thank you very much. And I think I'll be handing back to Dr. Mandana next.
Yes, thank you so much. Thank you, everyone. Please put on all your cameras. And I must say, anyone who has watched this has to agree and would have realized how lucky, how fortunate I am as a person, and how fortunate Oral Pathology 360 is to have the opportunity to work with this fantastic group of people every year. It is truly something I love and enjoy. It's the upside of the conference besides everything else. I mean, really it is. And you guys are fantastic. I think almost everybody here I have known for some time. Our only new addition, I think, is Dr. Yaqeen, but I have also known him for some time. Everybody else has already been in the conference. All right, Dr. Deshpande also is a new addition to the conference, but everyone has either attended the conference or has been involved with organizing the conference already. So it's wonderful. And we don't really have any questions. We do have one of our old attendees, Dr. Naveed Iqbal. Hello to you. And he says, very nice initiative. Congratulations to all. We do hope he will join us again. But I think we have more or less covered everything.
Mandana, if I might come in.
Yes, please.
I forgot to tell about the keynote speakers for oral pathology. So
yes.
Dr. Josh Hill,
yes, whose topic is a surprise.
Yeah, and of course, everyone knows Dr. Lester Thompson, stalwart on salivary gland pathology. So he will be covering it. Dr.
Yes.
Josh, sorry, I forgot to take your name.
That is all right. I think he is keeping all of us, chewing our fingernails and wondering what he's going to speak about. He hasn't told us as yet. We are going to have a, big unveiling maybe on that day of this topic. Yes. So anyone else who has anything that you may have noticed that we forgot or that we need to cover?
Ma'am, I don't think I mentioned how they should register for the abstract. Number one. Number two, I didn't mention that they will be allowed one extra session for them to listen to 15 days, up to 15 days after the closure of the conference. I'm sorry, I didn't know that I had to mention it.
No, that's okay. So the pre-conference basically is that everyone gets a choice. With their registration, you will get one complimentary pre-conference track. However, we are aware that the topics we have chosen are very interesting, and there may be those who may want to watch more than one. In which case, you can always register for more than one. Of course, you will be able to attend only one live, but that's a physical limitation of not being able to do more than one thing at a time. But you can watch whatever number you have registered for in the duration that the recording is available. And you will also get your certificate for those additional ones as long as you watch them. So that is about the pre-conference. And I think another thing we never really touched about is how to register for the conference. So the registration is open. Yes. If you go to the website, and in fact, I have pinned a comment right now on the top of the chat, which basically is the website. And if you just go to the registration tab, you will see the amounts. Currently, there is a good discount of the first 100. There's a specific discount that you can use. Now, to access this discount for international participants, there's actually a coupon code you will have to enter. The code is given there. For participants from India who are using the Indian platform for payment, you have to enter your details, the first 3 details of your name, email, and phone number. And once you click the first pay, only in the next page or the next screen will the discount be applied. Okay, so unless you do that, you won't see the discount. Don't get worried as to why it's not showing. And the overall process of the registration is, once you make the payment, we will send you an email with a link to a registration form. You finish filling out that registration form, and we will send you back an email with the confirmation and your registration ID. Please pay attention to your email. It may go into your spam folder, but it is very essential that you find our email, because not only the registration ID, but eventually the link to be able to enter the conference and all the other conference information will be finally sent to you by email. You need to be able to access it. So look around for our email. It just sometimes lands in the spam folder. So that's about the registration. Anything else anyone wants to add? Geronimo, your mic is muted.
Oh, sorry. I think we have pretty much covered the basics. We are here for you. If you have any questions, you can send an email or a message through the IG website.
Yes, we can, and very soon we will be sharing all the details of all the organizing team with emails that they would like to share, so that people can get in touch with you who are comfortable to reach out to different members. And I also think we have covered everything. So maybe if no one has anything else to say, we can call it an evening. Right? One should never extend beyond is required. Okay, let's just do that. Let's just say bye. It's been great. Thank you, everybody. And lovely to be with you all people, but also lovely to be with the audience. Take care. Bye.
Okay. Bye.
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 Bye. I will turn off the live.
Bye-bye. Be well.
Bye.
Take care.
Bye, ma'am. Sorry, there is a power cut here. I couldn't help it, ma'am. At least
that's okay.
not during the live.
You will not believe it, but I'm having a problem ending the stream.
Yeah,
Okay.
ma'am, I was so surprised, because I had a, when you said that it is not working, I was surprised.
Actually, your
We are
voice
having
is
a little.
breaking.
Okay, 1 minute. I got to go, otherwise the stream will not end. Okay, folks.
Fine, ma'am. Bye, ma'am.
Yeah,
Bye, everyone. Bye,
bye.
Bye. Bye, everyone.